Hi everyone, I would like to start this pharmacokinetics tutorial here in this channel. I believe that this series of tutorials will help you understand these topics clearly and have a firm pharmacokinetic base. Listeners, there are a lot to know in the world of pharmacokinetics. So pharmacokinetics is the field of science that deals with the kinetics of drugs, absorption, distribution, and elimination. It refers to the relationship between drug concentration at the site of action and the resulting effect, including the time course and the intensity of therapeutic and adverse effects. In short, what the body do to the drug. Now, if you confuse between pharmacokinetics and pharmacodynamics, let's try to understand what is pharmacodynamics. So it is the study of a drug's molecular, biochemical, and physiological effects or actions. It deals with the consequences of the drug's actions. For example, after the drug binds to the receptor, uh, and the consequences that occurs after the drug binds to the receptors. What are the actions? For example, if we give insulin to a patient, it will decreases the glucose level. So that is the pharmacodynamic action of insulin. So basically, pharmacokinetics is divided broadly into absorption, distribution, metabolism, and excretion. This is a huge area, and I hope that you will all be confident enough to talk and discuss by the end of the session about the basics of pharmacokinetics. I took help from multiple books, journals, and above all, my experience in clinical pharmacology and to be specific in clinical pharmacokinetics. So let's start. So when we take an oral drug, the degree of absorption of the drug varies based on the nature of the drug as well as the nature of the body, our body. So here you can see these two graphs with different PK profiles. In the first graph, you can see the concentration of the drug. This is the concentration, and that is the on the y-axis, and axis determines the time. So the concentration of the drug increases with time, reaches a peak. This is the peak, and then gradually decline. However, in the second graph, the rise in the drug concentration increases gradually, but the decline is not smooth. This is because the process of distribution, elimination is not straightforward. We'll learn about that in our next classes. The idea to show you all these drugs is the PK characteristic of the drugs. To be precise, oral drug, the PK is not same. In fact, it is not even for the same formulation of a drug. Suppose if we take a drug to be in a capsule form or in a tablet form, the PK is will be different. So whether it is we are taking it a tablet or capsule or any other form, like if you say that something like intradermal and subcutaneous of a certain drug, a different formulation, the PK characteristics will be different. So how drug is absorbed? There are various ways the drug is absorbed in the body. We'll discuss about it. And the same drug, if the route of administration is changed, it will give a different PK. So these are the route of administration based on the necessity, how the drug should help us basically. You can see this is oral, this is sublingual. I mean, if the absorption takes fast in this case, so it is used in some immediate life-threatening conditions like angina pectoris. It is being used. This is inhalation asthma is being used. You can see the different types of injection that is being used like intramuscular, subcutaneous, intravenous, intradermal. So in the thing is that the way it is being given, it will affect the way the drug will absorb in the body. Similarly, there are other way the drug is being given like eye, in the ear also, in the nasal, intraperitoneal is being given, intraarticular in case of rheumatoid arthritis, vaginal sometimes some type of hormonal drugs being used here, intravesical, that is a BCG, that is the one of the most you can say common example that is being given, intravesical, intrathecal epidural that is being given in anesthesia, intraarterial also is being given, as well as intracavernous, that is the venous thing. So these are some of the drug that is being absorbed. You can follow your textbook to get the examples of the drugs that are being used through this route. So what happens when a drug is administered? So after oral administration, the drug is absorbed from the site of administration to the systemic circulation. Systemic circulation here is like arterial and venous circulation. The drug is distributed to all. parts of the body? Yes, for that you need your drug need to be in the circulation and it will be carried by the blood to the different tissues of the body. And then the drug is eliminated from the body by metabolism or excretion. Metabolism in the form of some like enzymatic, some hepatic metabolism, and excretion in the form of in the urine. So that is being the drug being is being excreted. To understand it more, let's see the following figure. So here we can see two graphs. You can see the first graph directly comes at 120. You can see the 120 microgram per ml. Then slowly and gradually it decreases. So both are like ibuprofen. These are NSAIDs. One is given orally. Okay, the red one is given orally, and this one is given. The blue one is given IV. So if we give the drug IV, obviously it will sharply increases with a within a quick span of time. Then after that, the drug decreases because there is elimination as well as distribution is going in for the drug. But if the drug is being given orally, slowly, it will increase, and then after that, it decreases. So what you can see is that what I would like to show you, is, to make you people understand that the pharmacokinetic parameters are different if you give the drug IV and when you give the drug oral. The AUC of the formulation is also different in that case because some of the drugs it will be metabolized in the liver, and as a result, if you take 100 milligram of ibuprofen, it will not be the exact 800 milligram that reaches the systemic circulation. That's what you can see with the parenteral administration, that is through IV ibuprofen. Now let's learn some of the basics of pharmacokinetics, some parameters that you need to know about it. Okay, these are most important PK parameters. One is Cmax, that is peak plasma concentration. So it is defined as the point of maximum concentration of a drug in plasma, and it's called the peak, and the concentration of drug at the peak is known as peak plasma concentration. It is also called as the peak height concentration and maximum drug concentration. It's hardly being used, but what you have to remember is that the peak plasma concentration, Cmax. And it is expressed as, this is how it is being expressed, and it is expressed as microgram, it depends on what data you are using. So the peak represents the point of time. So this is the peak I am referring to. When absorption rate equals elimination rate of drug. So this is the absorption. So if we give a drug orally, the concentration of drug increases and again it decreases. So this is the point when the rate of absorption is equal to the rate of elimination. The portion of the curve to the left of the peak represents the absorption phase. That is what I mentioned. This is the absorption phase. And when the rate of absorption is greater than the rate of elimination. Okay, so this is the point that absorption is more than the elimination. The section of the curve to the right of the peak generally represents the elimination phase. Here, this is the elimination. This is absorption, and this is elimination. Okay. This is in this condition, rate of elimination exceeds the rate of absorption. So peak concentration is often related to the intensity of the pharmacological response and should ideally be above the minimum effective concentration but less than the maximum safe concentration. So this is one of the parameters you should try to remember. But what it is, the most important is that you have to remember about the Cmax, the first thing, and as well as the other one is the Tmax. So the concurrently the time at which the concentration of the drug in the body is high, that is the Cmax, is known as Tmax. So it is just like you have to remember that this is the time point when the concentration uh, increases in the body to the highest level. The peak plasma rate depends on the rate of absorption as well as rate of elimination. That's what is very important. So if the rate of elimination of this ibuprofen is less, then would have been in a different you can say the curve. Okay, so it will not directly fall to the zero level. It will go slowly, and it will fall. It will take more time for that. So as I mentioned, the time of peak concentration, this is a Tmax. So time for a drug to reach peak concentration in the plasma is called the time of peak concentration. It is expressed as hours and it's useful in estimating the rate of absorption. This is the x-axis reflects the times in the drug is administered, and the y-axis the concentration of the drug. So the onset time and the onset of action are dependent upon the Tmax. So that is very important. That need to be remembered. So what exactly is the clinical significance of Tmax? So these parameters is of particular importance in assessing the efficacy of drugs used to treat acute conditions like pain and insomnia, which can be treated by single dose. So if the Tmax is like, if it would have been like here, and it would be like around 6 hours. If you're suffering from excruciating pain and it takes 6 hours for a drug to reach the peak concentration here, so that has no value means in that case. So if you're having a severe pain, you need a drug which have a Tmax of around 30 minutes, not even 1 hour, like 30 less than 30 minutes, so that the drugs the person get relief in that case. And for that, you have the drug has to reach the peak concentration. So that's why it is very important. Tmax as well as Cmax. So this is the third parameter that is highly important, the area under the curve. So this is known as AUC, the short form, and it's very important to estimate bioavailability of a drug. So we will learn about bioavailability in our next class. So basically, it represents the total integrated area under the plasma level time profile and expresses the total amount of drug that comes to the systemic circulation after its administration. So it is the most important parameter in evaluating the bioavailability of a drug from its dosage form, as it represents the extent of absorption. The x-axis includes the time, so this is the time, so just like the Tmax and the Cmax, and the y-axis the plasma concentration. These expresses like we have to mention about the concentration per ml into the time factors. So AUC is also important for drugs that are administered repeatedly for the treatment of chronic conditions like asthma or epilepsy. So it helps us to understand what is the concentration, total amount of drugs that comes into the systemic circulation after its administration. Basically, it helps more to that. It helps to compare between the two drugs, how exactly the drugs behave. You can say accumulate in the body. So this is how why one of the most important clinical its relevance to use of AOC apart from bioavailability. So let's try to understand about one more parameter, that is absorption rate constant. So it is being generally assumed that the pharmacokinetic process takes place at a rate that is directly proportional to the mass of a drug available to undergo the process. That is, they are considered first order. So what is the first order kinetics? So we'll discuss about this in details in the chapter of distribution and metabolism. What I could tell you now that for easy understanding that most of the drug follows first order kinetics, and the absorption and elimination depend on the concentration of the drug. So if you want to understand the rate of absorption, calculate, we have to know the mass of the drug available for absorption, that is like 100 milligram, into absorption rate constant of the drug. So how the drug is generally being absorbed, that is, it's constant for the drug. So if a drug is being given orally, then it follows that the rate at which the drug is absorbed will depend on the mass of the drug uh, in the gut available for absorption and upon the absorption rate constant. So that is very important. So this drug theophylline might be aware that it is being used in asthma. It is a very old drug. The value of this absorption rate constant is not simply a fixed value for each drug entity. Okay, you have to remember that. It depends upon dosage form. For example, theophylline containing a simple tablet will be absorbed more rapidly than the same drug in the slow release form. So even it is like 400 milligram, like 400 milligram here and here also. But since it is a slow releasing tablet, means it is uh, manifested in such a way that the absorption process will be slow from the gut. Okay, so that's why the absorption rate constant will be different for this both the molecule, both the means formulation of theophylline. So generally, the absorption rate constant is same of the if it is the same drug and it is available in the same formulation. So if it is theophylline 300 milligram IP with the same excipient, etc., is being made by a different company, then in the same way, then the Ka might be similar in that case. So what you can see here is the rate of absorption, mass of drug available for absorption into absorption rate constant. And if you see the graph, we have absorption rate constant. This is 3, this is zero point 0.6 and 0.25. The higher the absorption rate constant, the more quicker the Cmax and Tmax will be observed, which is really like 1 hour, 1 hour, as compared to here the Tmax and it's like 6 hours. So definitely the absorption rate constant with 3 per hour is the winner here. So this is all from my side today. I would like to request you people to please like and share my channel. And yes, my next tutorial is on bioavailability. See you then. Bye bye.